do sincerely and solemnly declare that as a registered medical or dental practitioner of Nigeria.
These are medical doctors being sworn into Medical and Dental Council of Nigeria, a prerequisite for medical personnel who are new entrants into the medical industry in Nigeria. In an interaction with some of the celebrants, they said apart from the language barrier faced in their various institutions in China, Ukraine, and other countries, the comparison in terms of equipment, facilities, and expertise stands clear.
Well, I think coming back home was a motivation for me, because there in Ukraine, language was also a barrier, and racism too, it's also there. And because of the language, I want to get better as a doctor. If I'm to stay in Ukraine, I won't really get better there because of the language barrier. So coming home and building my clinical skills from here, it's actually much more better than being in Ukraine.
In my school, you might face little challenge of language problem because not all the patients speak English. A lot speak Turkish, but if you know Turkish, then you're fine. But
honestly, for the comparison, I haven't studied in Nigeria. I only have hearsay. I know it's way easier there, and apparently they're more advanced in certain aspects.
Some of the doctors were particular in their lamentation over the strikes in Nigeria, which tends to elongate the period of study.
Basically, I think it's almost the same or even harder than Nigeria, because Sudan is also an African country. We deal with same problems as in Nigeria, but the main difference is there's no strike and your studies will just go on smoothly. If you are supposed to spend 6 years, you spend the 6 years and graduate. But in Nigeria, the main problem is the strike. Because of 6 years or 7 years, it will take you like 10 years.
Well, medicine is a little bit very difficult. I know many parents want to tell their children that it's easy and it can be done. Yes, it's easy and it can be done, but you have to put in a lot of hard work. So that's really the basic challenge.
Well, I would say it's not the same, because here in Nigeria, definitely there are challenges, and then there, once you start, you just finish completely.
Some of these doctors promise to do their best to improve the medical system of Nigeria.
Well, I plan to impact good and change. There's so many things we would like to change, improve actually, because well, our leaders have done a lot, so we also have to contribute for that future before this.
Well, I believe that with the knowledge I was able to attain over there, I'll be able to translate that into what we have over here. That is actually what I pray for. Also, it was what the remedial program I attended helped me and exposed me to the prevalence of diseases that we encounter over here. And I hope that with the knowledge I attained over there in Ukraine, and with the tutors I had over here that were able to quickly abreast me with the Nigerian system, I'll be able to excel by God's grace.
By God's grace, we will live up to that standard that our senior colleagues have created for us. There are big shoes to fill, but we are trusting God that by God's grace we will start something.
These doctors are of the opinion that a streamlined educational curriculum, less disruptions from ASU strike, and improved medical facilities could make the surgeon of future medical students and practitioners more rewarding, and also curb the desire to study or practice abroad. Palang Bukar, PTV News, Abuja.